Meet Dr. Jose. He's a periodontist, a diamond cut above the rest, yet his bedside manner is warm, welcoming, understanding, and inspirational. And of course there's Dr. Torres. She has the philosophy that time is measured to the extent by which it is used, and not to the extent to which it passes, making her exact, deliberate, and beautiful as a perfect diamond. And then there's Dr. Chon. Hands of a surgeon, mind of an engineer, and the heart of a hero.
Hey, welcome back. I'm Dr. Chon. Today I have a patient. We're doing what I call a connective tissue graft. We do these cases where a patient might be deficient in their gum tissue around a tooth and they have some recession. Sometimes these patients present with sensitivity, cold sensitivity when they drink cold water or eat something really hot. And so in cases like that, we do this procedure to try to thicken up the tissue, and if we can, try to get as much coverage on the root to help with that sensitivity. Long term, these work out awesome, and yeah, we'll get this going today.
Kind of exposing the root structure a little bit so the tissue can bind properly. I make small little incisions around the teeth, and there's many different ways to do a tissue graft. For this connective tissue graft, I'm doing a technique called tunneling, where I tunnel between the teeth and push back the gums kind of away and kind of get underneath and make a little pocket where I can put tissue and kind of plump up the area. Yeah, so after kind of doing that whole process, you know, she had about 3 millimeters worth of recession, like way down up here. And then now, after kind of releasing or tunneling around everywhere, you can see the flexibility in her tissues now, and it's kind of covering where the recession was. So what we'll do in this case now, we know the preparation for the area is complete. Now we're going to go to the roof of the mouth and get a piece of tissue where we're going to kind of tunnel it underneath this area, kind of suture it into place, and then we'll close up afterwards. Okay. We just got the piece that we kind of need. And then we just kind of compress on the top to make sure that we control bleeding. Now we're just kind of closing up the top where we got the tissue from. Tissue that we kind of took from the palate, situated where it needs to be. Now we kind of have everything in place, and now it's a matter of just kind of bringing her existing tissue in there and kind of raising it up and kind of covering everything. Now open it for me. Good, and go and bite down for me. But yeah, no, this looks great. We did this entire area. Alright, now we're in good shape. Okay.
Alright, so we just finished up right now for our connective tissue graft on the upper left area. We worked on teeth numbers 11 and 12. We planned to just do one tooth, but you know, I kind of saw the tooth next to us, so I was like, you know, I'm there anyway, so let's get it done. So we were able to do 2 teeth for her. So the purpose of, you know, we wanted to thicken the tissue up and try to cover that area. Any sensitivity areas that would help with that kind of, this process would help with the sensitivity. And so we took a tissue from the roof of the mouth, transplanted it over, fixated it where we want to thicken the tissue up, got our existing tissues and kind of raised it up and try to cover the root areas where things would be typically sensitive on the tooth. And so everything went, you know, according to plan. turned out awesome. On the right side, we already did one over there. Plump tissue, got great coverage there. And so, as long as the patient takes good care of it, we expect the same kind of result on the left side as well. And typically with these kind of follow-ups, the sutures I place, they stay there. We have to take them out. But usually we want them to be there for about 3 weeks to 4 weeks. And if they're even tighter, we just kind of let them be a little longer. But that's usually about the time where we take everything out and kind of assess how everything's kind of gone. All right, thank you.
So this next patient we're going to do today, she has a periodontal abscess in tooth number 19, which is the lower left. She's been having some pain and discomfort on the area. The plan will be taking the tooth out. We all know that leaving an infected tooth in your mouth, it could lead to further infection and bone destruction. So we're going to be extracting the tooth today. We're going to clean the infection very well, disinfecting the area, and grab some bone. We wanted to preserve the bone that the patient still have, so we can eventually come back and place an implant on the area.
Hi, my name is Mary Shego. I came here today. I have tooth infection, and I came here today to tooth extraction for Dr. Torres. So I'll be having a surgery soon.
My name is Carrie. I am one of Dr. Jose's assistants. I'm basically his second assistant. I have been with the practice for 3 years now. I do a lot of surgeries, full mouth reconstructions. Those are my favorite procedures, actually. Soft tissue grafts, osseouses, extractions, same days. I really love the environment and the culture that we have. We kind of are basically like a family. We do lots of activities together. He takes us on trips. I love working with the patients. I love, bringing their anxieties down and making them feel, different from a lot of practices. I have a lot of patients saying, they've been to other practices where, maybe they were rushing or maybe they didn't take the time out to really care for the patient. So that's my main focus, is always towards the patient.
Extraction of Mary. Mary, how do you feel?
Yeah, good.
Great. Everything went as suspected. Excellent. We had the chance to take the tooth out and we cleaned the infection very well. Bone graft is in place. sutures done, and now it's just a healing period. We're expecting to heal for a really good 3 months before we can move forward with the second stage that it will be placing an implant. You're doing good? Thank you. We'll see you soon.
My name is David Rao. Well, I'm here to more or less get, I guess, the inserts of the implants tightened up. Well, right now the bottom is done with a temporary denture and the top needs to be done. Right now the inserts are in, but now they have to torque them down and go from there. Well, wearing dentures for 20 some years, you look for every avenue and everything under the sun in order to get implants. Well, my teeth kept coming loose. You know, you would pull one or get one removed, then another one would loosen up, and it was just a snowball effect. Dr. Joe's in this practice is really good and great. I mean, they look out for you. They do it right, and what I mean by that, they don't shortcut anything. They're here to work with you. I've already recommended, I'm going to say probably 40 or more people here. And that was just after my first experience and more or less talking to them. I will tell you this, the credit goes to my wife, because without her, I wouldn't be able to get this done.
Let's watch the case of Rodney Zeese, who owns Pino's Palace. He has a fractured tooth, but complicated in that it's next to an implant. Let's watch.
So we're just applying some topical jelly, you know, so before we even go in with the actual injection, you know, we just want to topically numb that area. And now once, you know, you might feel a little pinch here, it won't be too bad. That's all it is, and we'll do a little shake, shake, shake. Doing okay? So today there's a fractured tooth that we're going to take out next to an existing implant. So, you know, we obviously don't have to be careful not to do any damage to that one. Turn away from me a little bit. Alright, you know, this one's going to pinch on the top of it, okay? You okay?
That's a brave man.
Yeah.
My name's Elizabeth. I'm an assistant for Dr. Jose. I help him with surgery, setting up rooms, preparing patients. I've been here for about a month now, so I'm a little bit newer to it, but it's a great place to be.
I'll go back over here and kind of reinforce with some more. Help that one, huh? You okay, brother? That's it. So I'll give that about 5-10 minutes to kick in, all right?
Any clothes on that?
And I'll be back, all right? You can open half CC and non-resolved.
Sounds good.
So yeah, we're going to be extracting, doing some bone grafting. You know, doing the bone grafting preserves that bone volume. Often what happens is when we extract a tooth, if we just did nothing, we just let Mother Nature heal, bone will collapse. You know, you can lose as much as 50% of your bone volume in a horizontal dimension in 3 to 6 months as that socket is healing. So to prevent that, or to minimize that, you know, we have bone material that we'll kind of pack the socket with. We'll cover that with a little barrier. That barrier protects that bone grafting material. A couple of stitches go in, easy peasy. And then, you know, that preserves that bone volume so that eventually we can go back in and put a dental implant in, right? Because for an implant to go in, dental implant is a titanium screw. It replaces the root part of the tooth. It's the best thing that we have to replacing missing teeth, but it needs to go into bone, right? And the best way is now, you know, often some patients will come in and they'll have teeth taken out and they didn't get grafting done. So now it's tougher to grow that bone back, whereas where he is in the position, it's easy to preserve that bone volume just by doing simple grafting techniques.
What is bone material?
There's many types of bone material. You know, it all comes from an FDA-approved tissue bank. So you know, hospitals and us, we all get it from generally the same source. You know, but there's animal source, there's a human cadaver source, there's even synthetic. And I'm not so much of a big fan of synthetic because it doesn't turn over. You know, the idea behind any grafting material we use is that it turns over. All it does is encourage your own body's bone cells to come in and grow bone. You know, the idea is that the material that I put in, I don't want it to stay there because I want it to be vital tissue, you know, living tissue, right? So what I put in holds that space and encourages body cells to come in and grow the bone. So what I put in goes away over time, about 3 to 4 months. And so it turns into vital, the patient's own bone, and that's when we're ready to put an implant in.
Yeah, so far so good. And this young lady's been terrific. So.
Oh, thank you. Sometimes they're so low, so throughout the surgery we're bending over and we can rest our arm on something because we can't touch anything with our gloves.
Amazing.
Other than the instruments in the patient's mouth. But
I grew up in PA, so I was local around there, but I started dental assisting when I was about 19, so 3 years now, I want to say. It is impeccable. I had great experiences at my other offices. They taught me to do what I do now, but this office is amazing. They're always up to date. He's always improving the office, improving everything that he can for patients and their comfort. The best way is to make them feel comfortable, but also the newest technology to make sure everything goes smoothly.
Scott. And let's retract. So we started by just making our incisions around the sulcus of the tooth. As you can see here, I'm gonna check this out. Once I open wide from the sectional here, this tooth is split for him. See that? See how it's split in half there? Can you see that on the camera?
Mm-hmm.
So yeah, so that's why it's gotta come out. Yeah, the goal when we take his teeth out is preserve what's there, preserve the bone and just work our way to get the tooth. We have specialized instruments that can help us, atraumatically get the tooth in. So that's more fortunate, right? Doing okay? There's one part of it. And he doesn't feel any of this, because he's nice and numb. There's the rest of the tooth. So you can kind of see how, when he bit into something, that entire piece just sheared off and fractured. And now we want to kind of clean up that socket, remove any soft tissue lining within the socket. Correct? It is close to the sinus cavity, but it's not into the sinus cavity. If it was into the sinus, I would have to repair that as well. And so there. So we were able to do this without affecting any of the bone against that existing implant right here. Now we rinse out the socket with sterile water. Love it. This material, this membrane is sterile, and it's made out of dense PTFE, which is polytetrafluoroethylene. And what that, it's basically doesn't let any bacteria penetrate into our socket, right? So scissors. So I can trim it to, fit the socket. And what'll happen is, I try it in, make sure I like the fit of it. So now that that's ready, I'll put that right there. Put the bone. So use sterile gauze to just kind of clean up the area and clean up the blood, and then I'll bring in the bone. With this, we leave all this intact for 4 weeks, so I don't want that suture to dissolve away. So I like to have control over that. So we use this suture for this material, for this procedure. That's what I call a simple, a figure 8 suture. You'll just bring the root edges together and retract more anterior. There we go. And it'll keep that membrane in place. You can see nice and tight. Take another bite. One more time. Excellent. Good. Let's do mirror and irrigation again. And did you feel any of that? Good. You see the whole thing takes about 10 minutes, you know, for this type of case. 10-15 minutes. You can see now. And you can see the membrane's nicely intact, and the procedure went perfect. You know, all the bone is intact, and we grafted, and everything went really well. So now we'll see him in about, you know, he's on antibiotics and pain meds, of course, but I expect him to have minimal pain. And now he's on antibiotic treatment as well. And we'll see him back in 4 weeks to do a check and remove the stitches in the barrier, and then that continues to heal, and then we'll eventually put an implant in.
Absolutely amazing.
Is it? We'll see you in a couple of weeks, all right?
Yep.
All right. Good job, buddy.
Thank you.
That's excellent.
Told you, in and out.
Really, thank you so much.
Absolutely. Okay, I'll be right back with my stuff. These are those post-op instructions. Everything that I went over with you is on there. At the bottom on the other side, this is his cell phone number. If you have any concerns, if you're bleeding a little bit too much or more than you thought you would, if you're having immense pain, give us a call. Even if it's after hours, he will answer and be able to talk to you. This is that ice pack. I recommend icing as soon as you leave here. And then keeping that on. I know you're going to work today, but if you can, ice while you're away from the people. And then this is a soft bristle toothbrush. So I know I said that you can't brush for 24 hours. You're going to want to use this instead of your manual or electric toothbrush for that 2 week period of healing. Is that for you?
If you're uncomfortable with any aspect of your mouth, whether it's one tooth, a full mouth, coming in here and getting the experience that you would with the doctor, with the staff, your comfort is our priority.